I just want to remind everyone to turn off your microphones so that we don't get any background noise throughout the presentation. There's some people that we can turn off their microphones, but others we're not able to do it on our end. So just a reminder to make sure yours are turned off. There's going to be time for questions and answers at the end of the presentation, so if you have any questions, feel free to write them into the chat bar and we'll address them at the end of the presentation. And prior to this webinar, you should have received the handouts. They'll allow you to take notes during the presentation as Nancy moves through the information quite quickly. Just a reminder that this webinar is an overview of hot topics. And we have developed extensive webinars, toolkits, and workshops for all of these topics, which can be found on our online store at www.gowanhealth.com for purchase. So today you're going to be receiving valuable information about legal changes, research, and best practices to assist you in improving your approach to disability management in your organization. So, we'd like to take this time to let you all know that 2019 is our 20th anniversary. In honor of our 20th year celebration, we are donating $20 to a mental health charity for every referral we receive, and on the 20th of each month, which is today, that there will be a bonus surprise sale on some of our workshops and webinars. So stay tuned to our newsletters for other celebrations. So today is February 20th, so we are offering our Cognitive Demands Analysis Certificate Program, which is on April 9th and 10th in the Mississauga. It's on sale today for 40% off, and that ends at the end of the day. We have our OSOT Ergonomic Workshop on February 25th and 26th in Toronto, our Mental Health and Return to Work Workshop occurring in Halifax in May. We have our Applying Cognitive Therapy Principles on May 28th in Mississauga. And finally, our Return to Work boot camp will be held on November 12th and 13th in London, Ontario. We also have a lot of webinars available online, which include our Cognitive Demands Analysis Certificate Program and our new Mental Health Resiliency for employees and new exposure therapy for practitioners. And we're also going to be adding a Mental Health and Work Certificate, a Return to Work Certificate, and an Office Ergonomics Certificate program. We also have over 45 webinars available online. Great. So we'll talk a little bit about Gowan Consulting. So as I said, it's our 20th anniversary. So we have 20 years in our private business. We provide Canada-wide services. We have occupational... Oh, just a reminder to everybody to please turn off your microphones so that we don't get that background noise. We have occupational therapists and ergonomists, sorry. We focus on functional ability and work services, which include ergonomics, accommodation, stay at work, return to work, training, policy development, and workshops. We believe in making the complex simple and working together for a healthy business. We recently reinstated our mission, so we're doing more of a heart mission now, and our mission is to inspire change and empower ourselves and others to live their most meaningful lives. So today we're going to be discussing accessibility, WSIB, violence and harassment, the legalization of cannabis, changes to the Employment Standards Act, research on disability management, psychological health and safety, mental health and return to work, and new resources. So I'd just like to take this time to introduce Nancy. So Nancy Gowan will be presenting the information today. She's an occupational therapist, a certified disability management professional. She has over 30 years of experience in helping employees and employers work together. She's the owner of Gowan Consulting, an international speaker and trainer, and the author of Human Resources Guide to Managing Disability in the Workplace. All right, we're so lucky to get the opportunity to receive this free training, so welcome, Nancy.
Thank you, Steph. Now that was Steph Campbell, and all of you who have been receiving the Tuesday tips, you'll be able to see those regularly, and that's because Steph works hard to make sure you've got a Tuesday tip in your inbox to help you to be productive, to have some strategies around mental health, communication, time management, and return to work. So make sure that you're on our list to continue to get that. Steph also helps with putting together our blogs and our social media campaign and all of our events planning. So it's great that we've got Steph available to help in all those areas. So let's get started. I'm just going to mute some of the phones before we get started, just to make sure that we have some clarity in terms of the sound and that it allows individuals to be able to hear clearly. Hopefully you can see. I'm not sure why our thing at the top is still showing and covering part of your screen, but technology is not our friend. So let's get into some of the changes that have happened in the last year. There are lots of different opportunities to be able to take a look at how we can improve things for our employees in our workplaces. The first starts us out with the accessibility laws. In Ontario, if those of you are in Ontario, you're probably well aware of the Accessibility for Ontarians with Disability Act. AODA is fully in place. All organizations at this point in time must complete those requirements. So whether you're public or private, educational institution, all standards should be put into place. Particularly, we want to make sure that you're training your staff on AODA, on the accessibility and customer service, as well as human rights. Those are all part of the standards under AODA. We also know that your websites and content should be WCAG level AA, and at this point, customer service, employment standards, design of public spaces, information and communication, education, and public transportation standards should all be implemented in your Ontario workplaces. In Manitoba, they have followed a similar process to AODA, but their first standard was just put into place for November 1st, 2018 to the private sector employers. This includes the customer service standard. And so we want to make sure that you have that in place. So similarly, you want to make sure all of your employees are trained on AMA and have the Human Rights Code training as well. The Manitoba government indicated that they're going to start monitoring compliance in 2019 or 2020, and that standards on employment and information and communication is currently drafted. In Nova Scotia, an Accessibility Act was passed in 2017. At this point, Nova Scotia has none of the standards in place. They're all under development. One of the major things that came across our desk was the federal government changes to the Accessible Canada Act. So Bill C-81 was put into place in terms of passing third reading on November 27th, and it went into first reading in the Senate on November 29th, 2018. The federal government is taking a slightly different approach than to those in the provinces, that they are not taking a standards approach, but what they're asking is that all federally regulated employers become accessible by developing an accessibility plan, reporting on the success of that plan, and reporting to the government on their accessibility. So there are not specific standards similar to AODA, but each federally regulated employer needs to ensure that they're becoming accessible and developing an accessibility plan. Now, what are some of the changes under human rights? Just one second. So under human rights, there hasn't been a lot of changes or a lot of adjustments this year. The main thing was in BC, that BC human rights, there was the limitation for filing of a human rights complaint in BC has been extended from 6 months to 12 months. And the Human Rights Commission has been re-established. That means that similar to Ontario's Human Rights Commission, they're not an adjudicative body, but they're education, resource development, reporting, and research. And they continue to have the tribunal, which is the adjudicative body. So, BC Human Rights, if you have organizations or come from BC, pay attention to that, especially the limitation for filing being extended to 12 months. Now, let's pay attention to some of the research. And just before we do that, I'm just going to try to mute some of the phones, if you can, just so that the noise isn't going to impact anybody else on the system. We want to make sure that everybody has clear ability to hear all of this exciting stuff. All right, so let's talk about the research. What research has been published this year that might impact disability management? Well, the first research is that around being able to look at supervisors and their reaction to injured workers, and how it helps or dissuades return to work. So the Institute for Work and Health published in August 2018 the results of a study done by Dr. Arif Juthis and published in the Journal of Occupational Rehabilitation. It noted that if the supervisor has a supportive reaction to an injury, so empathetic, reassuring, that this can matter and has a strong correlation to return to work. So it's even more strong than social support in the workplace. It actually is 2 to 3 more times sustained return to work was demonstrated than having an unsupportive manager. Not a shock to a lot of us, but nice to see the research that is demonstrating that. In terms of accommodation, accommodating individuals with mental illness, the Institute for Work and Health reported on a Mental Health Commission of Canada report around the benefits that outweigh the costs of accommodating people with mental illness. So for employers, they reported that the economic benefits are 2 to 7 times the costs incurred, and for accommodated workers, 4 to 12 times that cost. And the Mental Health Commission of Canada website has a clear business case for hiring aspiring workers. That report is available free of charge through that website. The team is also working on developing a tool for a business case. And so it's important to take a look at what are the recommendations. So one is to build an inclusive workplace culture, develop standards for proper communication, attend to workplace physical and social environments, offer and strengthen supports and benefits, build in flexibility, encourage work teams to connect and support each other, and document informal accommodations in writing. So again, those support an inclusive workplace. What were the costs that they looked at? And that's usually the question that we have when we're looking at costs and benefits. This report looked at planning costs, evaluation, training, professional consultant fees, equipment purchases, accommodation maintenance, flexible schedule, and those were the main costs involved in the cost benefit. The benefits included job satisfaction, having an intent to stay at work, work absences, replacement costs, productivity at work, organizational citizenship, staff turnover, attraction and retention, organization or work climate culture, organizational accountability, reputation, insurance and other payroll costs, and compliance related to expenses. So we'll look forward to seeing the tool that is created that will help us all in taking a look at the cost benefit of accommodation. The Institute for Work and Health also presented a new screening tool for psychosocial hazards. This tool was created by OCAL and CCOHS, and it is a free online survey tool that has been validated by the Institute for Work and Health. It's called www.stressassess.ca, and you can take this as an individual or as an organization. For those of you who are working on your psychological health and safety in the workplace standards and implementing those, you may want to pay attention to the Stress Assess online survey tool that will help to give you a status of where your organization sits, as well as various other opportunities to be able to look at tools to affect psychological improvement. The areas that are measured are work demands, job employment factors, the quality of the job, values, supports, the physical environment, workplace culture, and health symptoms. There's also a new guide that was published by the Institute for Work and Health on ways to support workers with depression. So the Institute for Work and Health presented in April of 2018 an evidence-informed guide to support people with depression in the workplace. This guide is based on the evidence we presented last year in our disability management update with respect to the moderate evidence of having generic CBT improving stay at work and work-focused CBT having a positive effect on stay at work and return to work. That full guide can be accessed, again, at the Institute for Work and Health website at iwh.on.ca. I also had the opportunity to be able to present and attend at the Institute for, or the International Forum for Disability Management in Vancouver in October of 2018. During that time, there were a number of interesting presentations that were presented globally from different organizations. One of the ones that I felt was really important to share was by Dr. Marcos Iglesias. For those of you who are aware of him, he is out of the US, but presents the evidence and the research and compiling those factors that impact return to work. He's identified those as biological red flags. So those of us that perhaps are over 40 may take longer to return to work. Female, or if we have some comorbid conditions like obesity, diabetes, COPD, or we smoke or use opioids. Sorry, my lips aren't working today. Opioids, those are biological red flags that might slow down the return to work of an individual. He also identified system black flags. So the type of compensation that the employee is receiving, administrative delays, so making decisions about payment or claim approval can slow down return to work, as well as iatrogenesis. So for those individuals in the system that support not getting active again, that can cause some delay in return to work. The blue flags were identified as perceptions about work. So when an employee has job dissatisfaction, an unsupportive work environment, a workplace climate that has workload pressures and overload, a belief that work will cause injury, heavy manual work, or a long-distance commute, those individuals are likely to take longer in their return to work process. For psychosocial barriers, the yellow flags that he identified were that fear of re-injury, fear of reprisals, slowed recovery expectation, catastrophic thinking, perceived injustice, maladaptive coping, or the absence of positive adaptive behaviors, low social support, dysfunctional family situation, and adverse childhood events all led to a delay in return to work. And that's why we utilize a number of questionnaires to determine these psychosocial factors in individuals that are returning to work. He also identified that those that had psychiatric illnesses were also orange flags. So depression, so major depressive disorder, anxiety disorders, poor coping and adjustment disorders, unpleasant experience, traumatic experience, or PTSD. And so the more traumatic, the more delayed in return to work. Maladaptive behavior and personality disorders, absence of positive adaptive behaviors, and job avoidance were all areas that impacted return to work. So one of the things that you want to do is maybe pay attention to how do you assess an individual? Do you assess those areas? Are they clearly identified to be able to impact a more successful and a speedy return to work? I want to also bring attention to some of the new publications that we've noted that are out there for those of you in clinical work. You may want to pay attention to the 2018 Psychological Approaches to Pain Management, 3rd edition. So Turk and Gatchell have created a 3rd edition of their Practitioner's Handbook. I find that that's a very helpful tool. There's also 2018 guidelines for early management of patients with acute ischemic stroke, a guideline for healthcare professionals that was published by the American Heart Association in 2018. So let's talk a bit about WSIB, the Workers' Compensation System in Ontario. From the 2017 annual report, we noted that there were for Schedule 1 employers, there were 7.8 average days lost within 1 month post-injury date. And that 30% of the allowed lost time claims were high impact claims, and 42% of all lost time benefits. So we want to pay attention to those more complex claims that may be costing more of the benefits process. The types of injuries that Schedule 1 employers experienced were 44% sprains and strains from 19% overexertion and 70% lower back. So we thought that we had MSD under control, but we still need to pay attention to that and need to be able to make sure that we're considering the strategies around ergonomics, around lifting, and ways to be able to prevent those sprains and strains. Similarly, Schedule 2 also noted 47% of their lost time claims were sprains and strains, yet their event was from falling on the same level, and part of the body was multiple parts of the body. Their average days lost within 1 month post-injury was 7.4 as compared to 7.8 with the Schedule 1, and they had less percentage of high-impact claims. So it's interesting in terms of Schedule 2, how their stats play out. One of the things that WSIB noted is that their return-to-work staff made more than 22,000 workplace visits, and 89% of injured workers were off full loss of earnings benefits 1 month after that return-to-work staff member's involvement. So you'll see a lot of return-to-work specialists getting out there, getting involved in the return-to-work process. What were some of the changes, though, to the WSIB policies that maybe impacted what's happening in Ontario? Well, the two are mainly around stress and stress claims. Stress claims after January 1st, 2018, we saw the post-traumatic stress disorder in first responders and other designated workers that all those claims included then a presumptive cause. And we noted that that actually was revised in September 2018 to include nursing in the first responder categories. So if you're in healthcare, you want to be paying attention to that. We also see some concern around the chronic mental stress policy, and I'll talk to that. Getting a bit of background noise, so I'm just going to try and do a few other muting of phones before I proceed, just so that there's some squealing going on there, and so let's see if we can cut some of that out to make it easier to listen. So what are the criteria for the first responders? And they needed a diagnosis of post-traumatic stress by an appropriate psychologist or psychiatrist. And they were a first responder. Then it was presumed that the PTSD was caused in the course of employment. And as I noted, in September 2018, nurses have been added to that first responder list. Here is the updates from September 2018 policy, which includes all of those that are covered as first responders or other designated workers. And you see nurses who directly provide patient care are now included. So what are the treatment and return to work planning? What do we see happening in WSIB? I see an overload of claims, a number of claims coming through, some difficulty in getting those claims into some comprehensive treatment quite quickly. But we are needing to pay attention. If you are in that first responders group, you want to make sure that you're asking for a comprehensive assessment, making sure that the treatment that is being provided is most evidence-based. And that includes treatment by a psychologist and some in vivo exposure therapy with an occupational therapist and return to work planning. All of the evidence is showing that those are the components that we want to make sure are in place. And there are some PTSD guidelines that came out in 2017 that we can also make available to you if you email me, and we'll send those on to you. Some interesting research coming out of the Schulich School of UWO. Technology not being my friend, but it seems like artificial intelligence is coming into the healthcare sector. Testing artificial intelligence to predict post-traumatic stress disorder in patients, that some of that research is showing a 92% accuracy when it was tested on 181 patients. This artificial intelligence is still being researched, but we are seeing that this is probably something that is coming forward that we want to pay attention to, and we want to make sure that we are noting that technology maybe can be an accurate way to get a better diagnosis. So what can you do as an employer? One, implement preventative programming. For those of you who are first responders organizations, you have the requirement to have a mental health strategy, a prevention strategy, but it's time to make sure that that programming is implemented well. Prevention is really key. Developing of that resiliency, ensuring that we are having the right preventative resiliency training for our first responders. We also want to see timely and active treatment access. So if you have first responders that are dealing with WSIB, being sure that you're paying attention to talking to that case manager and nurse consultant to say, can we get more active treatment? Can we make sure that this individual is getting the evidence-based care that they need, and that they're getting some reactivation, some work-focused CBT, some in vivo exposure therapy, and as well coaching managers and providing work modifications. Now let's talk about the chronic mental stress policy. We were all up in arms last year and wondered how many claims were going to come through, what was going to happen with the chronic mental stress claims. So with this, any claim after January 1st, 2018 where the individual had a DSM diagnosis by a health professional, had experienced a substantial work-related stressor, and that the stressor in the workplace was the predominant cause, could make a chronic mental stress claim. Now, we've noted that in some of those claims being disallowed or not allowed, that the stressor cannot be something that is expected as part of the essential job. Again, this brings us back to making sure that your job tasks are well documented, well identified, what is the core essential duties of the job, because if it is a part of the expected essential duties, that employee is well aware of it when they come into it, it cannot be a chronic mental stress claim. We did have a report in December of 2018 from the Toronto Star. The Work and Health reporter indicated that 94% of chronic mental stress cases between January and May were not approved. So just 10 of 159 claims from January to May were approved. So I'm not sure, in talking to some of the employers that we've been talking to lately, whether this continues, but we do see a longer process for the approval of a chronic mental stress claim, and we do see that they're working on clarifying that process and policy. So what can you do as an employer? Well, this gives you the opportunity to look at preventative measures. Address your psychological risk factors in your workplace. Offer preventative programs on management of stress. Update your policies and procedures, particularly around violence and harassment, and make sure that your procedures are actually enacted and aren't dust on a shelf, but making sure that it's effective. From a reactive point of view, document your job roles and responsibilities with cognitive and behavioral demands analysis. Steph mentioned, you come to our workshop today, you get 40% off on how to do cognitive demands analysis. So you might want to pay attention to that if you're a professional looking to perform those tasks. Offer suitable, timely, and safe return to work and stay at work. So looking at cognitive and behavioral accommodations, looking at how that person interacts in the workplace and the cognitive requirements, because there are quite a few possible accommodations you can provide to have that employee returning back into the workplace. You may want to be performing functional cognitive assessments, some reactivation. You want to give that employee early access to work-focused CBT, and you may be looking at communication training and conflict resolution in the workplace for the team as well as for the employee that is making the chronic mental stress claim. We want to look at this as an opportunity to improve our workplace and to help employees to gain the skills to be successful in their work. So let's talk a little bit about harassment and violence in the workplace. Not a lot of changes in that area other than through the federal Canada Labour Code changes. So if you are under a federally regulated, under the Canada Labour Code, you want to pay attention to Bill C-65. With C-65, it received royal assent, and this included the right of the employee to have employment free of sexual harassment. The employer makes every reasonable effort to make sure that the employee is not subjected to sexual harassment, and making sure that there's consultation on policy statements around sexual harassment. So that may not be new to many of you in Ontario with Bill 168 and Bill 132, but now the Canada Labour Code has those changes made, and that we need to make sure that those processes and policies are in place for federally regulated employers. So let's talk about the employment law changes. Wow. In Ontario, our heads have been spinning from Bill 148 to 47. Minimum wage was going up. No, it's not. Scheduling was changing. Personal emergency leave changes. There's a lot of things that have reverted back from Bill 148 back to the employment standards that were there before. I don't have a lot of time to go into all of those, but if you are in Ontario, you want to pay attention to Bill 47 and what are your current requirements under the Ontario Open for Business Act. And of course, we're all excited about the legalization of cannabis. We've been talking about that for a year or two, and as of October 17th, 2018, cannabis is legal in Canada. So under Bill C-45, this act regulates the possession, growth, and distribution of cannabis. So every province, though, determines age, distribution, and enforcement. And Ontario specifically, we had thought that it was going to be distributed by mail only, but there is now look at having storefront availability. The legal age depends on the province, with 19 being Ontario's legal age, and a possible move to privatizing the distribution network. So how does this play out for you as an employer? Really, this isn't any different, other than we all got our impairment policies up to code. We made sure that there was opportunity to ensure that the code of conduct and the use of substance in the workplace was revised. And so we want to pay attention to impairment of employees at work. How do we determine impairment? How do you deal with it? Your policies are hopefully all up to date. There was a big whirlwind of lawyers who were able to help you with your policy updates, your procedures for detection, the actions to be taken, and testing for safety-sensitive positions with consequences. We do see that some employers have taken the no use of cannabis in certain safety-sensitive jobs. And this comes from some of the arbitrations that are out there. And one of the recent arbitrations awarded to Lower Churchill Transmission Construction Employers Association and EBU Local, that the arbitrator found that it would be undue hardship to try to accommodate the use of medical marijuana in safety-sensitive positions. So in this situation, in this arbitration, the decision was that there really was no means to determine the level of impairment, that the 4-hour driving restriction that is generally given by a physician is not sufficient because the physician cannot assess the impairment for safety-sensitive roles or prescribe appropriate levels. So we have seen different organizations that have banned the use of medical marijuana or cannabis in order to perform safety-sensitive roles. Suncor has been involved in a big arbitration and legal battle about applying random drug testing for safety-sensitive positions. The most recent decision around that Suncor report is that they can apply random drug testing for safety-sensitive positions, but they need to be careful about what is the testing methods. TTC had created a decision that they are not allowing operators who use medical marijuana to operate or drive their vehicles. This is a fairly significant decision and one in which that we might want to pay attention to as we look at how we can determine who is safe to drive with the use of marijuana. Benefits coverage was also a dispute under the use of medical marijuana, and there's been various approaches by the benefit providers as to whether to cover medical marijuana or not. So you may want to check with your benefits provider to see what their decisions have been around the coverage of medical marijuana. The next issue is talking about psychological health and safety in the workplace. All of you are well aware of the national standards around psychological health and safety in the workplace that was voluntarily created in 2013 by the Mental Health Commission of Canada and CSA. We have some new resources that have been put out this year that you might want to pay attention to help you in that management of this psychological health and safety in the workplace. One, a toolkit has been, a free toolkit has been created by CCOHS, and it's called Assembling the Pieces. So this is a toolkit that was created with the Mental Health Commission of Canada, and it's free use for individuals or employers trying to implement the psychological health and safety standards. We also came across some interesting videos. For those who aren't aware, the Ontario Public Health Unit created a video series on each of the 13 psychological health and safety standards and how employees and managers can implement those standards. It's a great video tool, free to use and able to be utilized in your workplaces to help employers and employees to understand what do each of those 13 psychological factors mean and what does it look like in implementing that psychological safety. There is also free training that the Mental Health Commission of Canada has through their website called The Working Mind. And this is free training for employees on how to stay psychologically safe. Again, some great resources. There's probably a lot more that you're aware of, but feel free to email me, send me some of the resources you've found, and let's put together some resource kit for everyone's benefit. We also want to, of course, because I'm an occupational therapist, I'm going to reinforce the research that has been published to have occupational therapy interventions involved to positively influence your return to work. Specifically around workplace mental health, Moll et al. Has published a result of a survey of the Ontario occupational therapists in terms of our current practice around workplace mental health. The Ontario Society of Occupational Therapists is currently working on tools for the occupational therapist to be able to support mental health and return to work practices and best practice in that area. Some of the other things that we've come across is, as I say, technology is not my friend, but there is mental health resiliency apps that can be very helpful for individuals trying to implement good mental health resiliency. So Calm, Headspace, Post-Traumatic Stress Disorder, CBT, Breathe Ball, Mindwell U, Meditation app, all of these different apps. I'm not going to go through each of them, but there are free components and some of them are paid apps, but they help in looking at some resiliency. We do want to make sure that our employees have the tools that they need to maintain their resiliency, and some of these applications are very good at reinforcing mindfulness, reinforcing good breathing, meditation, staying calm, gratitude, all those things that are in fact evidence-based around building our resiliency. And the next thing I'm going to talk a bit about is we're going to move to the ergonomic guidelines. I know last year we talked about sit versus stand, what's out there. In 2017, CSA upgraded their office ergonomic standards. So I'm just going to talk a bit about what their guidelines say to help you in your ergonomic side of things. One, as we all are aware, it is good to move. So we want to alternate working postures between sitting and standing. We want to make sure that we want to move from a fully seated position to standing position, but we don't want standing statically either. Movement, body is made to move. So sit-stand furniture or accessories can help you achieve that, but they're not always necessary. We can look at alternate alternating tasks that require sitting and standing, putting in micro breaks, getting up and moving around, doing some stretches. Those are all healthy work behaviors. So when do we want to use sitting primarily? According to the guidelines, we want when we are doing concentrated, focused work, like computer work, proofing documents, telephone computer tasks, then primarily sitting is a good work posture. The majority of tasks should not be sitting all the time. We want to build in brief periods of standing. And we want to make sure that we're not doing a lot of reaching into the outer reaches, the tertiary zones, and not lifting more than 4.5 kilograms. That we don't want to be sitting. If we're lifting a lot and reaching a lot, we need to be in a more movement-focused environment. So that's where standing comes in. If there is considerable movement away from the workstation or movement within the workstation, we want to make sure that we are standing and having a moving posture. If we're lifting more than 4.5 kilograms, we want to move. And if we're frequently reaching for equipment or other items into the outer zones of the desk or the workstation, then standing is a better posture. Semi-standing, well, that's our perch. We can use that, and they've found through research in the U.S. that semi-standing is good when we're trying to be at the same level as a client or a customer, but we also want to have the opportunity to do some rest. So perching can be an accommodation for someone who can't fully sit or can't stand, or we're in that banking, customer service area. Semi-standing is better, but we want the opportunity to move and to sit or perch. Alternating sitting to standing can happen if we have long durations of concentrated and focused work that you perform in a seated posture, but then you get up and move around, you get up and have some micro breaks. That's going to be better for you. So overall, in summary, our takeaway today is, what do we want to do? We need to keep an accessibility focus. Develop an accessibility plan. Depending on your province, make sure you've implemented all of the standards appropriately, but continuing to make accessibility part of our business activities. Given some of the research, we want to consider manager training as a priority. How do we train managers to be mindful, to be empathetic, to be supportive of employees when they're distressed or challenged? Through that, focusing on psychological health and safety in the workplace. Looking at our harassment process, how do we recover from a harassment claim? How do we reduce harassment in our workplace? And help employees to be able to work successfully in that workplace without the psychological risk factors. We want to revisit your impairment policies and procedures. If you haven't done that, make sure that you've revisited those, that they're clear, that you've educated employees about the responsibilities around cannabis and the use of cannabis in the workplace. And if you have an office environment, you might want to consider reviewing your office ergonomics, making sure that you've included some of those new CSA guidelines. Note that the CSA guidelines also speak to lighting, to blue light, to a number of different areas in terms of office ergonomics. That has changed since the last office ergonomic guidelines came out several years ago. So I want to thank you, and we're going to move to some questions. So I'll pass it back to Steph. It looks like the only question is that I could send you an email about what I wanted to, something on slide 40. I'll take a look at that, Anita, and make sure that we send that out to you. Is there any other questions that anyone has? Let me just unmute your phones and see if people have any questions, given what we've shared today. I think that we're close to being all unmuted. Is there anyone that has any questions? I'll pass it back to Sept then.
Okay. Thanks so much, Nancy, for taking the time to deliver this information in such a comprehensive and structured way. It's greatly appreciated. And thanks to all of you for joining us today to learn the Disability Management Update of 2018. Speaking of disability management, we've been nominated to receive the HR Reader's Choice Award for Disability Management Consultants. I sent out an email to everybody earlier with a link where you can go and vote for us, so if you would take the time to do that, it'd be greatly appreciated. And as mentioned earlier, we have some deals and offers for you guys. So today, if you sign up for our Cognitive Domains Analysis program, the workshop is 40% off today only. We're also offering our mental health and productivity strategic consultation at a discounted rate for the first 20 people to purchase it. It's originally priced at $1,500, and we're selling it for $149. There's a link where you can sign up there on your screen. It includes a comprehensive white paper on mental health and productivity, a consultation session with our Work Solutions Manager to review your workplace mental health statistics, risks, identify gaps in your program, and provide steps to improve your workplace mental health program. All of this can be done virtually, so anyone can purchase it. So you just have to go to our online store at www.gowanhealth.com, and it's under Resources. Also, if you like our Facebook page, follow us on Instagram, follow our Twitter, or add us on LinkedIn. Your name will be entered into a draw. And then the winner will receive a free webinar of their choice. So they can pick any webinar on our website, and we'll give it to them for free. Thanks so much for your participation. We hope you gain lots of insight and get to put policy to practice as soon as possible. Take care, everyone.
Thank you.